that we continue with anxiety as we had planned for it for last week, but we could not have. It's so sad and so unfortunate that during Suicide Awareness Month that we did have a case. This is why again today I felt it very, very necessary to speak about anxiety. And please again, I'm asking that everyone please be your brother's keeper. Even though persons have big smiles on their faces and all, please always find out what is happening, what is going on. This may save a life. Okay? So I'll pass you on over to our special guest. Let him introduce himself and we take it from there. Thank you.
Okay. Hello, good morning. My name is Leon Cherry. I'm from Viewfort and I work with Insight Therapy in Black Bay Viewfort. So I work there as an assistant psychologist. So my job basically is that I see clients under supervision by the owner of their practice, Miss Priscilla Joseph. And so I have been working with her for the past 2 years. I say maybe 2.5 years, I should say. And yeah, so I felt it important to speak about anxiety because it's something that I see often in the clients that come to our practice, and not just that, but overall in speaking to young people, especially. We When we have discussions with them, I realize a lot of people struggle with high levels of anxiety, and more than that, they can be debilitating. It can have a severe impact on the way that you function. So, what I want to do today is to kind of break it down to explain, okay, what it is, also what it's not, to like maybe clear up any misconceptions, and then to kind of talk about, what higher levels of anxiety would look like, what the different causes are, and anything related to that. So, yeah.
Okay. So we promise to have a very good show. Listen in carefully. And for the first time since I've been here, it would be great to have persons calling in to give us some feedback. So over to you, sir.
Okay. So what I want to do first is to give like a general definition. Now, I will give the definition and then I'll kind of break it down in simple terms. So, the APA Dictionary of Psychology defines anxiety as an emotion characterized by apprehension and physiological symptoms of tension in which an individual anticipates impending danger, catastrophe, or misfortune. So I know it may sound a bit complicated, but I will kind of break it down. So it says it's an emotion, and that not only that, but there's different components. So there is the psychological component, meaning the emotion, like you feel apprehension, you feel tense, you feel worried, and also there is a thought process that would go with anxiety. So maybe there's something on your mind that you've been thinking about for maybe most of your life or maybe recently. And also in that, there is the physiological side, meaning how you feel it in your body. So together, you have an emotion that you feel, emotion of apprehension, and then you have a thought process, worry, tension, and then your body, in terms you'll feel maybe a little slightly elevated heart rate, or maybe you'll feel some tightness in your throat. So you're a little bit nervous, so you feel like, okay, you find it difficult to talk. Maybe you find it hard to breathe, like your breathing is restricted, or you maybe feel something in the pit of your stomach. So anxiety has all these different sides. So the emotional side, the cognitive side, meaning the thought processes that would go with it, and the physical side, so how it would manifest in the body. So
Thank you.
yeah.
So can I ask you this definition? Could you give us an example of what it would look like when somebody has anxiety? For instance, you've encountered persons who have anxiety. So, say for example, you say, I will say, Ulan, he has anxiety, what would he look like? What would be happening with him?
Okay, so what I would do is to kind of give an example.
Okay.
So we have a person and they maybe find it difficult to speak in public settings. So, and so they were asked to come and to maybe give a presentation or something along that line. And so you have an instance where the person, beforehand, they will be thinking, okay, so we'll go to the cognitive side, the thought process side. The person is worried, okay, what if I make a mistake? What if I embarrass myself? What if I don't make any sense to the people listening? And then on the emotional side, s- they feel almost apprehensive, like they feel like they cannot they cannot really explain it, but like they feel like this sense to avoid, what it is like they asked to do. And so, but more than that, they, for the most part, maybe the night before of them being asked to do that, they will feel restless, while they sleep, and they'll have difficulty falling asleep, and they will just be going over maybe an image in their mind of them making a mistake or of them embarrassing themselves. So in that instance, what the person is feeling, everything put together, the emotion, the thought process, and also them feeling restless and all of that together would be categorized as anxiety.
Awesome, awesome. So you're saying that anxiety almost looks like when somebody is afraid.
Yeah.
They're afraid of feeling, they're afraid of doing stuff.
Mhm.
And along with um, being afraid is not saying that you're seeing a potential danger per se,
Mhm.
that you need to run away. But being
Mhm.
afraid could be like afraid to fail, or
Mhm.
afraid to feel sick, or
Yeah.
afraid to, and then this person will start acting out, right?
Yeah.
Right. So, okay, I kind of get the picture.
Yeah.
So, alright.
So it would be important to distinguish anxiety and fear. So there's a fear response that would occur maybe to like immediate danger. So like maybe you somebody who works in the forest and you see a snake, or you see maybe you're at home and you see a centipede, like like something that would bring you um, immediate danger. Your response, like you running away, you feeling nervous, that would be categorized as fear. But anxiety is different. It's like the thing is not in front of you. It maybe hasn't happened yet, or maybe you have to face it at some point. And so the emotion comes from you maybe anticipating that it would be disastrous to to encounter that thing, or go through that situation, or see that person, or be in a certain setting. So the difference is fear is a response to something immediate and present,
Mhm.
but anxiety would be something that is almost imagined, or is almost like in anticipation of something happening. Yeah.
Thank you for explaining the difference. Okay, perfect. Yes. Okay.
So going down, there are different types of anxiety. So there's something called situation anxiety. So you feel nervous about being in a particular situation, like a social setting. Let's say you have to be in a crowd where you have to interact with a lot of people, or you have to give a presentation in class the next day, or you have to maybe read a scripture verse in church, or maybe you have to go somewhere for the first time. Maybe you a child who just started primary school, and you have to take a bus for the first time. So being in a situation, there's something called situational anxiety. Moving on, there's phobic anxiety. Now, I think before I say what phobic anxiety is, I should explain what a phobia is. Okay, so I feel like sometimes terms like phobia can be used loosely. Like maybe you don't like grasshoppers, or you don't like cockroaches, or whatever. you know. But a phobia is something more than that. So there is two sides to it. So there is the there's the associated association side, and then there's the avoidance side. So some phobias also, they would not make sense, and I will explain why. Right? Yeah. So let's say you have an instance where somebody is afraid of something harmless, like um, let's say beetles, beetles that fly. And somebody would say, why is that person like deathly afraid of it? And what can happen sometimes is at the point where you may be in a situation, or you encounter in something like that animal, sometimes what happens is you have a traumatic event. So let's say when you were younger, your little cousins, or your older cousins, sorry, would take beetles, and they would try their best to scare you with these beetles, right? So over time, you will learn to associate that that animal with that traumatic like experience of them trying to scare you with it, and maybe it's something that happened over time. So eventually, like, it's almost like it comes together, and you associate that with the trauma, because when you think of it, you think of, yeah, they tried to scare me so many times, they put it in my ears or whatever, I was sleeping in it or whatever. And the avoidance side is when, because you associate with it with that traumatic event, then now you start to avoid it, and then now that behaviors get reinforced, right? So what happens is, over time, as you avoid it every time, you feel a little bit more at ease, because you avoid like that, having that association. So these things together would create like a phobia. So you basically avoiding it because you associate with that event. So that's why sometimes people, it will not make sense, but when you look at the science behind it, then it will make sense that, yeah, somebody would be afraid of something simple. Maybe they're afraid of heights, or being in, yeah, afraid of the dark, something like that. Yeah. So moving on to the different types of anxiety. The last one would be anticipatory anxiety. So it's like anxiety in response to, um, but I should say, like, beforehand. So before you get into, maybe like I mentioned earlier, having to read a scripture verse in church, or yeah. So yeah, yeah, like me. Yeah. So night before, you're thinking, boy, I don't want to make any mistakes. I don't want to embarrass myself. Yes. So yeah. Mhm. So, but before I continue, are there any questions you want to ask about anything I mentioned so far?
So far, you're very clear, very
Mhm.
on point, so to speak.
Okay.
So continue.
Okay. So I'll move on. So now I described what anxiety is. And so, what I want to explain now is what high anxiety will look like. So, you, a person, who struggles with anxiety, they would sometimes be experience dizziness, you would feel tired. And I will kind of explain, kind of like the science behind the tiredness moving forward. Um, you will maybe have a regular heartbeat. Sometimes you have muscle aches or muscle tension, and it would be in different parts of the body, maybe in your throat. You would feel it in your chest. So you feel like kind of like a tightness in your chest, but, almost you may feel like maybe something wrong with my heart or something like that. But it's really like just anxiety manifesting itself in the body. And speaking of the body, I should clarify, there's something called psychosomatic illnesses. And what it means is that sometimes, these certain disorders, like psychological disorders, can manifest itself in the body. So, in the case of anxiety, sometimes you may have a person who actually have a lot of stomach problems, and they may go to the doctor, and the doctor will tell them, well, I do the tests and everything is fine, like, I don't see anything wrong. But for some reason, you find yourself, your stomach always boiling, like, and you don't understand why the doctor's not giving you a response. And sometimes what happens is the anxiety that causing like your you to have these experiences. So
So would you be saying that um, it's not imaginary, but it would be something that's not real? It would be like what you would call. Well, I remembered once a doctor was explaining to me that there was something called a mimic pregnancy, where this person really wanted to be pregnant and they started exhibiting all the signs of being pregnant. Even the stomach was growing. What? Yes, and there was no baby. But that person was not pregnant at all. Yes. So sometimes our thought process, our psychology is so high that our body would start imitating what we're thinking. Wow. Yeah, it's that. Yeah, we get to be rich. Yes. So this is why they said that you think it into existence. Think big. Right. So thank you.
so if you give us something different, you can think yourself to be strong, have a six pack, maybe you'll manifest it.
Indeed.
Yeah, but there's, as you mentioned, that there's something in psychology called the nocebo effect, and what that is basically that if you believe that you have a certain illness, you can actually start experiencing or manifesting the symptoms of the illness without you necessarily having it. Yeah,
That's all in the mind.
yeah. So you can literally, if you think you're sick, your nose can start running, and you're getting a fever and all of that, and there's nothing there. So yeah, so the mind is very powerful, and understanding it will help you, in life. Yeah. So moving on, with symptoms of high anxiety, you can have dry mouth, excessive sweating, shortness of breath, stomach aches, like I mentioned earlier, feeling sick. You could have headaches, and you can have difficulty falling asleep. So what we would call insomnia, or you stay asleep for a long period of time. So we call that hypersomnia. Sorry. Yeah. So when people experience high symptoms of anxiety, that will relate to the next topic, well, which are anxiety disorders. Now, for something to be classified as a disorder, most of the time it'll have to meet certain criteria for it to be classified as a disorder. Now, I can kind of go in depth about like something called the DSM-5, and the DSM-5 stands for Diagnostic and Statistical Manual 5, and it's like a guide that psychologists use to
Psychology Bible.
yeah. So it's like basically almost like a bible of different disorders. And so what you would find in the DSM-5 is that it would kind of give an explanation of like a breakdown of the symptoms of like different disorders. Now, for some of the ones I'll mention now, like, and some people may be familiar with some of them: generalized anxiety disorder, social anxiety disorder, OCD, panic disorder.
OCD.
Okay, so OCD is obsessive compulsive disorder. Okay, agoraphobia, um, and separation anxiety disorder. Now, I don't want to go in depth about each of them, but I just want to kind of give a guide, like, yeah, yeah, because even though they use the DSM-5, for somebody to be diagnosed with a disorder, you would have to see a specialist, like maybe a psychiatrist or a clinician. And sometimes they would ask for a history, and they would do certain tests, and then they would like officially diagnose you with it. But at the same time, I feel it's still important to kind of give a general idea of like what these disorders would look like. Okay. Now, going back to something I said earlier, there's a difference between high anxiety and anxiety disorder. And one of the first things is that you can have high anxiety for specific reasons. You be in a season where you transition into something new, or you maybe just have a child, or yeah.
I think some water. All right, folks. Again, if you're just tuning in, we're talking about anxiety this morning right there on Sufre 88.5 FM. All right, guys. Okay. Yes.
It's okay.
So, what are statistics shows in terms of anxiety and persons who actually fall short?
When you say fall short, what do you
Well,
mean?
in terms of being suicidal.
Suicidal. Well, I feel like that might be almost like a jump. So, from high anxiety to suicide, because
Mm,
there will be a lot of different factors at present with one person that would bring them to that point.
mm,
And I feel sometimes it could be anxiety, but is sometimes in most cases would be more than that. It would be like,
depression or something like
yeah,
that.
so depression, low self-esteem,
Mm,
having an issue of abuse in your family, or feeling like hopeless. So it's like a whole myriad of
wow.
different reasons. And what would happen is it would bring someone to the point where they feel like they want whatever pain that they're experiencing to end.
Okay.
Mhm.
Mm,
So it's not that um, they don't want to live anymore,
mhm.
but that they just want whatever that they're experiencing in the moment to end. Yeah, but I feel I wouldn't want to like jump into
Okay.
suicide because yeah, I
Because
want to stick to the topic.
like you
Yeah,
said, it's sometimes just want the pain to end.
yeah,
You understand? Sometimes some persons,
mhm.
even again, like you mentioned, mentally they have it in mind. So even if they go to the doctor, they seek medical from a medical profession, it's still the pain is still it still exists
It's still
because
there.
again, it's mentally.
Mhm.
And sometimes you just want to get rid of it. You want to you know. Right.
So
Mm-hmm.
with some anxiety disorders,
Mm-hmm. Mm-hmm. Yeah. Okay, she's back with us. That is it. So with some anxiety disorders, you were saying.
so what would happen is what most of them would have in common is that you would have to be experiencing like high anxiety for a certain period of time. So in the case of the first one, like generalized anxiety disorder, it would be a case where it happened for a certain period, maybe I think about either a minimum of 6 weeks to 6 months. I'm not exactly clear on like the like specific criteria, but it would have to be something that's going on for some time. Um, Another thing that would kind of be different, from high anxiety to disorder is it will affect your normal functioning.
Okay.
So it would affect your ability to do your work, your ability to maybe go be a good spouse or be a good parent, be a good sibling. It would affect how you take on your responsibilities, whether you're in school or you're an adult. It would affect how you relate to the world, like it will affect how often you go outside, how often you speak to people, how often you socialize
So
with people.
social. That's the word. Socialize.
Yeah. So it would be something noticeable. Like, I notice Leon not functioning well at work. He not talking as much. He not doing his job well. Or maybe in the case of a child, the child not paying attention in class, or they've been sick a lot, something like that that would kind of affect your functioning, And so something like generalized anxiety disorder is basically you just having a high amount of anxiety, and it would maybe manifest itself in some of the ways I mentioned earlier, but also, to put it simply, like would affect your normal functioning. But at the same time, you would have to rule out maybe some of the causes of it. So maybe you abuse a certain like recreational drug, or you have a certain medical ailment that would kind of cause these symptoms. So like when you sit down with a psychologist and you give them your history and explain to them, then they would kind of put pieces together and rule out certain other causes, and then they could be like, okay, maybe you maybe have this disorder. Um,
So, as asked, so I just wanted to ask, were you saying that there's a difference between having high anxiety and having an anxiety
Yeah,
disorder.
yeah.
So, in general, in an example, because I think I missed out, I heard you given. So, somebody with high anxiety, for example, you would say would just maybe have signs of anxiety, as opposed to somebody with a disorder would actually need medication for
In some cases, yeah. Yeah, so maybe they may need medication, but that would be up to a psychiatrist, like
yeah,
to,
of course they
yeah,
would have to be diagnosed.
yeah. But
Right.
they may need medication, or also it would affect how they function, like on a like it would be noticeable. Not that,
And
yeah,
medication also can mean therapy.
yeah. Well, it would be part of
Yeah.
the a prescription made by either psychologist or a clinical psychologist. Yeah,
Okay. Thank you.
yeah. But what I would want to do is to kind of touch on two disorders that people are mostly familiar with. OCD, that's obsessive compulsive disorder, and then agoraphobia. So with OCD, I know sometimes people would think, okay, I like my environment clean. I have to make sure everything is in order. You know, and so I must have OCD. But that's not the case most times. OCD is something very different from you just having a desire to be clean or just naturally being a neat person. So
Need free.
yeah, so there's two sides to it. So there's the obsessive part, and then there is the compulsion part. So what you find is that people, and it's an anxiety disorder. So people who have OCD, they have an obsession, meaning that they have some recurring thought or image in their head about something, or they have a recurring belief that would be on their mind constantly, right? So let's say, for example, I have this image in my head that when I'm in a closed place, like let's say like now in the studio, like somebody might just come in and attack us, you
Yeah.
know. And so I'm obsessed with that image, meaning that I think about it all the time, like at work, even when I'm at home. It's just something that's going on in my mind that, okay, somebody might attack me at some point. And it's something that, it's really like it's on your mind. There's no point at which you're not thinking about that thing. It's like always reoccurring, it's always there. So that's the obsession. Now, how I deal with that obsession and the anxiety that will come from it is would now translate to me having a compulsion, right? So the compulsion is how you deal with that obsession. And so the fact that I've always thinking, yeah, boy, somebody will open that door, even though it's locked. Somebody will open the door and attack us. And so the way I deal with that obsession is I compulsively maybe check the door. So yeah, so if let's say using that going on that OCD example, you would find that even as I talk in, you would see me looking at the door every 5 minutes. Looking at the door, I check in. At one point I would stand and maybe check it to make sure it locked. Then you'd go back, maybe some time pass, you check again. So OCD, sometimes people would fall into different categories in OCD. So there's the counters, there's the washers, the germaphobes, and there's the checkers. So people would have different obsessions and compulsions that would match it. And so one thing to note too is that when you have that disorder, so like I aware, okay, Leon, like that not making sense for you to be checking the door all the time. Like I fully aware, like there's no benefit to me doing that. But even in me realizing that, I'm still compelled to do it. And that's despite me being fully aware that, I shouldn't be doing that all the time. So it's not a psychotic disorder when you're just doing that and not aware of reality. You're aware of the reality, but you compelled to
So
still,
isn't
yeah, check.
that it cannot be controlled?
Yeah, well, it the thing is it can be controlled. Well, yeah, yeah, in most
You
cases.
cannot control it naturally.
Yeah, yeah, yeah.
So you're going to give us an example of Because you said there are the checkers and the germaphobes and also
Mhm,
who are the checkers and who are.
mhm. Well, it would depend on what the obsession is. So I remember there was a case where I saw there was a guy. My brother told me about him. He was watching this YouTube video, and the guy had this belief that um, if we didn't count to a certain number, and then if he didn't check like everything in the house, like make sure it put everything in order, that his family would be killed. So yeah, it doesn't make sense. It doesn't make sense.
So
So
that's fits for me,
yeah, so yeah, so it's like okay, again going back to obsession. So he obsessed with that idea. Okay, boy, my family might be out of order, and he did more than just that too. He would like hit his chest a certain time, a certain amount of times. He would count things, so it would look like okay. Let's say if I was him, right? So I would have to. Let's say if I was a counter, I would be like 1, 2, 3, 4, you know, and then okay, in your mind you're thinking, okay, disaster averted, and then a little while later you're like, okay, I have to do it. 1, 2, 3, 4, 5, and then image come again, something might happen. One, two, or you check in.
That's real, man.
Yeah, so you check in. So let me check the phone. You check in the AC, you checking the lights. You're making sure that you safe, and then it's just a constant cycle of you doing that. And so OCD is way more than being clean, because it being a disorder means that it would affect your functioning. So most chances are you might not be able to have like a job, like a stable job that would require you to be engaged all the time, because your compulsions would kind of cause you to always be checking, always be counting. So you're at work, you counting. You're at work, you washing your hands, because maybe you're obsessed about.
So,
Mhm.
are there higher levels of OCD or lower levels of OCD, or would you say that OCD is actually the disorder, and what seemed to be OCD would be more of a high level of anxiety and not a disorder?
Yeah, well, exactly that. So it could be they have other explanations for someone maybe being clean or obsessively like orderly, you know, and it's it's always important to note the difference between disorder versus maybe having a like high level, because at some point it will go down. At some point, maybe the person will let their room go. They'll get messy at some point, even though they always clean. At some point, they would allow it to be dirty, or they'll have a day where they're in a rush. But OCD is like in a different realm. It's like, yeah, it would somebody would notice, y'all would notice me checking the door. You say like, what? You say, well, I'm to that man. I'm always looking at why I'm looking at the door all the time. I dare, I dare. So it would be different. Mhm.
So even with cleaning, somebody would, for example, clean the table, and
Mhm.
you'd find like, for example, they may have a cloth on the same spot, cleaning and cleaning. Like to them, it's never clean enough.
Mhm.
So would you say that at this point, it is maybe going beyond the high level to the disorder?
Well, in that situation, you would have to look at the full picture again. And so
Mhm.
maybe in speaking with them, they would have to be the two sides. So the obsession and the compulsion.
Sure.
So the two of them go together, because the obsession would cause that person a high level of anxiety, and then the compulsion would be to like alleviate it. But when they say obsession, they mean like in the full sense of the word, meaning that like you're really obsessed, like you really that thing never going out of your mind. And so you trying to what you basically your mission is to try and alleviate that anxiety that coming from that obsession, but it not going away, because going back to something I said earlier, phobias is kind of reinforced. So your behavior is reinforced when you engage in the compulsion. So it's like I check the door, I feel better from checking the door. So that feeling of feeling better, signaling to my brain, okay, this is a rewarding behavior. Yeah. So then you get more entrenched in the behavior, like, so it's almost like it's like a cycle, a self-perpetuating cycle. Obsession, compulsion, anxiety, ease for a little bit of moment, obsession, return again, and then you just in that spiral. Mhm. Okay.
Great information.
Indeed.
Yes.
So, moving on, I would mention panic disorder. So, someone who has panic attacks. Now, the thing about panic attacks is that it actually affects a huge percentage of the population. I think I don't have the exact figures, but sometimes it could be somewhere around between 10 and 20%, of people in like the general population would either experience a panic attack at some point or suffer from um, panic disorder. Now, I would explain, okay, what is a panic attack? Panic attack, yeah.
I was about to ask.
Yeah. So going back to the symptoms of high anxiety, it's a moment where you feel intense panic to the point where it could cause dizziness, it could cause, muscle tension. And I'll just clarify, sometimes all of them could be together. So, okay, you're dizzy in that, say in the moment you're dizzy, you have some tension, um, you shaking, you feel some shortness of breath, and then it's like it's all of a sudden to you. Although I will explain why it's not really all of a sudden, but in that moment, it's like you feel all of a sudden. I just feel tired. I feel dizzy, like the room spinning. I cannot breathe properly. I feel like some tightness in my chest, or it could be all of us. I sit down there, and it's like all of a sudden I just feel like I'm not really sitting on the chair. Like I'm having like some kind of out of body experience where I kind of like not I dare but I not really there. Or I have something that feels like a heart attack. Like you just feel all of a sudden, yeah, yeah. So it's like you so scared. It's like you have a heart attack. And sometimes what can happen is people have panic attacks and they get rushed to the hospital. They go to the hospital and like they fine. But when you have that attack in the moment, is basically you reaching a tipping point. So it's like everybody have their limits, and at that point, your anxiety reached to like the boiling point, and you have that panic. Now, I will kind of go back to like something I said earlier. All of a sudden, right? So most people who report having the panic attacks is that um, they say it's all of a sudden that they feel that thing, right? But what happens most cases is that um, even though that attack in that moment felt like that, most of the times these people actually suffer from high levels of anxiety like throughout their life. And sometimes what can happen is you have like a perfect storm of them feeling anxious most of their life and maybe them being in a situation in that moment that caused that already high level to reach a tipping point. So let's say, for example, I had something traumatic happen to me. I was in an accident when I was 10 years old. And since then, I've always been an anxious person because I am, again, going back to thought pattern. I thinking something might happen when I'm in a vehicle. The vehicle move too fast, something might happen. And I'm somebody who maybe has to take the bus regularly. So most of my life, I've been feeling anxious, about safety in particular. And I've been a tense person because, you know, it can cause muscle tension having high levels of anxiety. So I'm tense, I always think about my safety. And then maybe at 20 years old, something happened, I lose my job. Um, in me losing my job, I lose my apartment, and I have to stay with somebody, and in that moment, maybe something happened back home, like I say, if I'm living overseas or something. So you have like a perfect storm of very bad situation happening to me, like in the present, and me already being highly anxious coming together. And so in that moment, I panic, So one night, was I was maybe thinking, wow, boy, what am I going to do? What am I going to do? How am I going to get work? I just stay there and like I just feel like, like I cannot breathe properly. I have some kind of tightness in my chest and and so I pause and I'm like, what really going on? Next day I go to see the doctor or whatever. And so doctors say, well, everything is fine. You have no issues with your health. And so in that moment, that panic is something I never felt before, you know. And so what you will find with people with that disorder is that they already have high levels of anxiety. And now they had an experience which they cannot process. It's never happened to them before. And so it would create that fear of, okay, boy, I don't want that to happen again. I don't want that to happen again. You're at work. You don't want that to happen again. And so in you thinking, okay, I don't want to happen that to happen again. I don't want that to happen again. It causes you to have a second one. And so the distinction between panic attacks and the disorder is that it's something that may be reoccurring. So it's happened at least twice, and you not fully aware of like what's going on, and then you have that intense reaction in the moment. So that's just like a general idea of what it would look like.
Okay. Let me ask a question. You said that the person would be thinking of something.
Mhm.
Um, can somebody have a panic attack when they're not thinking about something? For example, you're there. Um, Maybe like you were saying earlier about some phobias and so on,
Mhm.
and you're in an enclosed environment and you're just there. And because you're kind of afraid of it, you're not thinking, you're conscious of whatever, and you're in an enclosed environment, and all of a sudden you're just starting to feel funny.
Mhm.
So that would be because of your phobia, or you're having a panic attack because of your phobia. Explain to me,
Okay.
please.
Well, it is, yeah. What you said is exactly right. So you're having a panic attack in response to the
To the
to the
to your
phobia.
phobia.
Yeah. And
But can you sorry, but can you have a panic attack without thinking about anything, or being away that you're
yeah.
even having a panic attack?
Yeah. Most cases. Now the thing is, people are different, and people
Mhm.
have different experiences, and there will be different reasons that would cause you to be already anxious and to have it. So I'll give an example. Sometimes people who drink coffee, just that feeling of being like stimulated by the coffee, and the fact that maybe your heart rate would be slightly elevated, that can induce panic attacks in some people. Other people exercise um, because of the fact that the exercise bringing about shortness of breath. You're trying
I
to,
think I've experienced
yeah,
that one.
so you short
Yes.
of breath, you kind of exhausted, and since the panic symptoms kind of similar to what going on in your exercising, then that could bring on the panic attacks. So
So, like somebody who just started out in the gym,
yeah.
and because of the elevated heart rate and everything, all
Mhm.
of a sudden you'll just be feeling that you're so sick,
Yeah.
but it's actually somewhat like a panic attack.
Yeah.
I think I experienced it once. I felt, oh my god, what is happening?
Yeah.
And,
But
yeah.
so it would happen for different reasons, like I said. But so it's not only the thought process, but and again, since you experience anxiety in your body as well, so
Mhm.
you feeling something physiological that kind of associated with panic could cause you to have that panic. And yeah, so it would make sense. Okay, before I wanted to touch on the causes of high anxiety, but I just wanted to clarify something. Agoraphobia. I don't know if you ever heard of Okay, so some people, a lot of people mistake it to mean the fear of open spaces. So you have a phobia of open spaces, but that's not what it is. What you have most times in agoraphobia is that there's a strong link between that phobia and panic disorder. And what happens is the person, because they have that panic, they're afraid to go in places where, not that places that are open, but places where they cannot like escape and like retreat from it. So let's say, for example, I had my first, maybe I've been having panic attacks for a while. And so the fear is that I will panic if I go in like a crowded place, or, I'm at church, or it'll happen in the supermarket. So because of that fear, the person will actually start to avoid these places, and so that's where the phobia, the fear of being in a space where you cannot escape. And so the two linked. Sometimes you will have agoraphobia without the panic disorder. So somebody who, for whatever reason, just afraid of going outside, or in extreme cases, they don't leave the house at all. Or it would be most times that the panic disorder came first, and then it became comorbid, means that the two of them kind of exist together. So I panic. I'm afraid of panicking in a space that I cannot open. Therefore, I avoid that space.
Mm.
Yeah,
Interesting.
yeah.
Yes.
So now moving to the cause of anxiety. So um, the main ones would be your childhood circumstances. So one, your parents communicate, and I have my some general notes. So your parents communicate an overly cautious view of the world. So what does that mean? It means a case where growing up, for example, your parents would always tell you, be careful, there are people that just kidnapping children, you know. So make sure you come home on time. Don't be out late, because something will happen, So like they communicate a view of the world that um is like it's a dangerous place, that you should do your best to just maybe move as quickly as possible, or a place where, because it's dangerous, you have to always be on guard and to always be looking.
Okay, that's
Yeah.
good.
So then you grow up with that belief. So you're going back to anxiety, a belief, Um, and so you have that in your mind. And so later on in life, and sometimes you might not even be aware of it. So in some cases, people, that's all you knew. Like that's what your parents taught you. So you think that's normal, and so you anxious in public spaces, you anxious on the bus, you look over your shoulder, and you may even have a high level of anxiety, but to you it's normal because you grew up that way. You know. So, but before I continue, how much time do we have? Because I
Let's ask her then. How much time do we have? So,
Let's go. We have what, 15 more minutes left, because I'll
15.
take the news at 1 o'clock.
okay.
And
Okay.
that's it. 15
Okay.
minutes.
So I will kind of just give the general points, and then yeah. So childhood circumstances, overly cautious view of the world. You have parents who overly critical of you. You can never do well enough. You get a B, they stressing over that. You have parents who set high standards. Parents who maybe suppress like you expressing yourself. So before you even get on, like children would, you excite yourself, you play, they're like, stop, stop making noise, stop whatever. You cannot be yourself. And so you learn to suppress your emotions and your natural self-expression. Um, and there's emotional insecurity and dependence. So, you have parents who cause you to be that way, to be insecure and to be overly dependent. And then just to give like general review, cumulative stress over time. Um, you and then there's short term or triggering causes, personal loss, changes in your life, having to move to another country, or a family member dying, like maybe a parent or a sibling. Um, and then there is trauma, that could cause high anxiety as well. Having a traumatic event, or maybe a sequence of traumatic events. So maybe something bad happened when you were 10, 15, and 20. Maybe at these points, you're either robbed or, had a near death experience or something along the lines. So there's a lot that could be said, but maybe in the interest of time, I will just, stop at this point.
So I just want to make a comment, and I'm sure Ellen could remember we spoke many times about childhood trauma and things that have come out of this. And I'm hearing you coming back, repeating or lamenting on childhood trauma again. So a lot of what builds up this anxiety disorder could be linked to your childhood traumas.
So I could give like an example, like, so because you had that event happen, you know, somebody robbed you maybe when you were 10, or 15 or whatever, you anxious or have been anxious like from that point, and then it reach a boiling point where that high anxiety start affecting your function in different ways, and then you now you know try to deal with it in a way that you're not sure of. But something I just want to say, overall, people have different backgrounds and different life stories. And sometimes what is normal to them may not be the normal for maybe most people or even acceptable. So your family environment was always turbulent, people always arguing, people always fighting. Maybe you had an abusive parent who was an alcoholic or whatever the case is. And so anxiety, although it could affect your functioning. Another way to look at it is just your mind trying to adapt to that environment and to put you in a state of readiness, because that heart rate, muscle tension, all of that is kind of like, you know, it's similar to having like a fight or flight response. Like your mind is telling you, okay, because all of that going on, um, you should be ready at all times. And so if there's anybody listening who have, some of the struggles that I mentioned, I just want them to know that in the same way someone would be sick and they would have a high fever, that fever would come from, your antibodies responding to the virus and trying to combat it. But the fever itself would be kind of damaging to you at the same time if it's too high. In the same way, our mind would respond to certain, phenomena or certain experiences in a way to kind of protect us or make us be at ease. And so we should not feel any guilt or shame or, any less sure of ourselves if we have any of these symptoms of anxiety or these disorders that I mentioned. You know, we do not um, put people down for being sick, and that's the physical. And so we shouldn't put people down or put ourselves down for having mental illness in the same way. And so I just wanted to, you know, end with that.
Thank you so very much. Yes. Again, just the last time we were on the show and we were speaking about mental illness, and I did mention, excuse me, I don't know what is happening to my voice. Yes, so I did, maybe, I did mention that, it's, we have this, there's this stigma attached to mental illness here in St. Lucia. So that is why you find a lot of persons almost like they go into hiding with it. They always believe that this one is going to say this about me or laugh at me and so on. So, like I always said, that the same way you go to the doctor for your headache and you go to the doctor for your pain, it is quite fine to go to the psychiatrist and the psychologist, the therapist, to get treated for whatever ailments you may have, because illnesses come, you have your emotional illnesses, your physical illnesses, and your psychological illnesses. So all are illnesses. And I'm happy to hear you today lamenting on again anxiety and what people need to look out. So thank you for the wealth of information that we got here.
Yeah, no
And I'm
problem.
hoping that you will come back with me again on Family Matters to give some insights on some other topics.
Okay.
Okay?
Okay.
I would love that persons would call in, ask questions, but as usual, they like to just listen in and not call in. But you did, in fact, give us a lot of information. Even I learned a lot today. And thank you so very much for that. So, persons out there who are listening, ensure that you take care of your mental health. It is very important to do so. Okay, and like Mr. Leon here said, I know here in St. Lucia we have this thing about going to a therapist and saying, Zafe moyo vle save, be makai just whistle no. You've ever realized that sometimes you're going through something and just by speaking about it, going to a friend, sitting and just hashing it out, venting out, how better you feel when you come out from there. So imagine you have a professional guiding you and helping you out with these issues. Okay, so sometimes, like Mr. Leon said, things that are seemingly normal for others are not normal for other people. So we don't have to judge or criticize persons about certain things because we do not know what is happening with them. Something as simple as putting on weight. Sometimes you ever see that you have not seen somebody for such a long time. I saw you today, you look quite slim, and tomorrow I'll see you all,
Okay.
bigger. So I'll be like, hey, what happened to you? What's going on? You drop yourself, and I will be going on and on about your weight, only to find out that it's a medical problem. Some issue is going on with you. So before I start going and saying, you drop yourself, look, it's alcohol, you must be drinking it, that's why your belly's so big, and all that. Ask questions. We need to know how to approach people. Because sometimes when we see somebody, before we give them a compliment, something negative will come and say, hey, what happened to you today? Your hair, So find out how you're doing, how has your day been? I've not seen you for such a long time. What is happening with you? Before you jump in something negative. Because just that could make a very big difference in somebody's life. Um, so Leon, thank you so much. And also tell us again where you work and what services are being offered, and of course maybe if it is for free and what the procedure is and so on. And also if you could give a number as well so persons can reach out.
Okay.
Yes,
So I
so that
have.
would be great.
So just give me a second. Okay. So Insight Therapy is located in Black Bay, and we have a number. So I'll just give my number. So my work number. So you could feel free to reach me at 733-3648 and 733-3648. And then I also work with an organization called New Leaf Wellness Center, and it's located in Viewfort. And we provide free counseling services to people to the south of the island. So as far as Denry and Soufriere as well. So if you fall within that range, and it's a team of therapists, social workers, and counselors, about 10 or 11 of us. And so I will share the numbers for New Leaf as well. So 733 3640 and 733 3641. So you could call at these numbers and you could speak to a professional, and then we do intake, and then based on what you report, we could then assign you to a counselor or a therapist, and at your convenience, and it's free of charge. So we don't, there's no fee attached to it. So
What are your hours like?
so most would work, I should say, from between 9 and 4, but depending on when you call and the explanation, like what you tell us, like your schedule is like, then we will see how best we can accommodate you. Yeah, so whether in person, or maybe you just want to do it over the phone, or maybe through Zoom, or if you want to come to one of our offices, yeah, our office spaces. Yeah.
Okay, thank you so much for that. And of course, during the 24-hour hotline is always available to free. And of course, your free would sometimes send you over to New Leaf or so on where they can. People always again reaching out to person, always get somebody to speak to. Taking your life is not the answer because yes, it's a ripple effect. Because after you've done that, do you think of who you've left behind, what is happening, even for you? Okay, so life is very precious. So always find somebody to speak to. Get call 203, call a number, do something. All right, go to the priest, go to your pastor. Yes. So, any closing lines? What would you like to see?
Okay, so in closing, I would like to say, whoever is listening, I know there was a lot of information presented, and you may have some answers and even more questions, but just know that you're not alone in your struggle, and that despite what you may think, there is help available, and that you can reach out to someone, reach out to one of these numbers, and then things can change.
Amen to that. Thank you so very much. And then I hope that you enjoyed the show as
Very
well.
nice. Very informative.
Okay, thank you.
Bye.
Bye.
Bye, folks. Bye, folks.
A wholesome and
So,
relationally healthy family.